Right now, with viruses is the top of every subject. Well, specifically, let's face it, there's one that rules here. But this show, I really believe it goes beyond this time of the coronavirus. This show is about vitamin C. So many questions right now on, is vitamin C a real solution for the coronavirus? Well, studies show that it is. So I brought an expert, our vitamin C expert, on the show to answer the question of how we utilize this for prevention, how we utilize it if we have someone who's sick. And she answers all those questions, including how to dose it orally and how to do IV if you really need a boost for this sickness. We also bring this topic into vitamin D, how to dose it, and the dangers of overdosing vitamin D potentially, how to avoid that. We even dipped our toe into zinc, the big three, if you will, on how to prevent illness in the winter, even if it's the regular flu, even beyond the coronavirus. But she'll bring her expertise, and as you'll hear, there's a reason she's our expert in this area.
Hello, everyone. Welcome to Cellular Healing TV. I'm Ashley Smith, and today we welcome Dr. Mignonne Mary, who is the founder and medical director of the Remedy Room clinics in and outside of New Orleans. Dr. Mary specializes in high-dose IV vitamin C, and her clinic focuses on treating the whole person and not just symptoms. She also promotes disease prevention. She is here today to discuss the antiviral power of IV vitamin C for prevention of illness as well as treatment to prevent further illness. This is such an important topic, especially in today's climate, so I cannot wait to get started. So let's welcome Dr. Mary and, of course, Dr. Pompa to the show. Welcome, both of you.
Thank you, Ashley. Thank you so much, Dr. Pompa, for having me today.
Yeah, no, Dr. Mary, you're our vitamin C expert here, and there's so much talk about it, for the coronavirus. And, I mean, even before this, I think that, there was still a need for this show because we get so many vitamin C questions, the difference of oral versus IV, and you're also going to help us dose both of these things, okay? Yeah. Because, again, oral dosing, there's a lot of controversy and mistakes made. You're going to clear that up. But let's go right after it here at the beginning about the coronavirus. But before we do that, I want you to understand, people to understand why you're our expert here. This is deep in your family, this vitamin C thing. So you're not just another doctor promoting doing IV vitamin C. So let's be clear. And I also want to be clear that you're doing amazing things in your clinic. You've trained with me for some years. So all that I thank you for. But tell us your story, how, the vitamin C story, at least part of that anyway.
Okay, I really appreciate it. Yeah, this is definitely in my blood for many years. So I am an internist by trade. I went to LSU here in New Orleans, and I have an older brother who's also an internist. And my dad, his name is Charles Mary. He was the youngest director of Charity Hospital in the early 70s. So this is the state-run hospital, and he's just always ahead of the game, very, very smart. And at an early part of his practice in the 70s, recognized that he wasn't really making a lot of progress with viral illnesses, went and trained, was at a conference and met Dr. Fred Klenner, who is based in North Carolina. And he challenged him to say, look, next time you have a mononucleosis patient, use 50 or 60,000 milligrams, that's 50 to 60 grams of vitamin C intravenously. And my dad called me, he's like, I think I have an extra zero on there. This can't be right, So he started using it and seeing great results. And he said, look, these college kids were out, they call it the kissing disease, right? They're out of school for at least a month, maybe longer, sometimes the whole semester. They're exhausted, they can't really recover. And I think a lot of your viewers and mine know that Epstein-Barr, cytomegalovirus, these things knock people down and they can recur, right? And cause a lot of fatigue. So within a day or two, he's got these patients that are asking for hamburgers and feeling more energetic and recovering. So it started with mono, and it started with Dr. Fred Klenner. So he then progressed to make friends with Linus Pauling and Robert Cathcart and these other doctors who really were the pioneers. then my dad started using it in the hospital setting, which, as a kid growing up with a dad who's a doctor, I would round with him. He really had the whole 6th floor of St. Charles General, where every person who he admitted, he even checked, they had low vitamin C levels, and he would give them all IV vitamin C. And he's quoted as saying, and still, he lives next door, Dan, so he's still, I talk to him all the time. He says,
Awesome.
I've never had a septic patient die who had gram-negative sepsis. And so the relevance of that today is that gram-negative sepsis or gram-negative bacteria acts very similar to viral illnesses, where they're endotoxins.
Yeah.
So he explains that this endotoxin inside the cell, that's where vitamin C can be so powerful, where it helps to neutralize those toxins and then allow your immune system to go in and repair and do what it needs to do. So on top of that, so he's got success with these viral illnesses. It progresses to, he's had patients with HIV he's treated, and then certainly he had his own colorectal cancer that he treated with megadoses of IV vitamin C, and ended up that he did not have any more cancer after they did the surgery. So he's got his own case. We've had multiple cases where we straddle the patient's care when they're getting chemo and radiation. What we know is that even high doses like 25,000, 50,000, 100,000 can be given to these patients who have chronic disease in a clinic setting. And we straddle their care, so when they're getting these therapies that are toxic to their cells, the vitamin C helps to neutralize the poisons and save and protect those other cells.
Right.
So it's a long history.
Yeah, that is amazing history.
Yeah.
Obviously, this is why she's our expert, folks. But, I think you stepped in to answer the question of why this is, being touted as something for coronavirus, right?
Yeah.
Obviously as prevention, but even there are people that have it, having trouble recovering, vitamin C. I guess it just begs, it's so simple and, inexpensive when you look at, the cost of ventilators. I mean, very inexpensive to all that. Yeah. Okay. Your family is a family of MDs, your father doing that in hospitals. Why isn't it catching on? Why aren't we hearing about it? Come on, if we're struggling in, certain areas with people, why isn't it catching on?
I think it's shining a light on the something that you and I have talked about, and certainly all of the, your listeners are aware of, is that there's a major disconnect between doctors thinking about nutrition and cellular medicine and practicing medicine where we're using prescriptions and having these knee jerks of like, if you have this problem, then we give this pill or this drug, instead of looking at the whole person and thinking, okay, how can we strengthen that person and keep their immune system well? Like the biggest piece that we need to make people aware of is that without vitamin C, the immune system cannot work properly. Now, that also goes for vitamin D, and there are now studies proving that even with COVID specifically, that people who are admitted to the hospital who have low vitamin Ds are not faring as well. And that's because of that natural killer cell. We need those natural killer cells inside the cell. And so, that's a scourge that's around the world. That's not just in America, right? So we're shining a light on that we don't shine the light enough, that we're not in the sun, that we're nutritionally deficient. So you say it very well, that you have to fix the cell to get well. And in cellular medicine, if you can't communicate, if you can't get the nutrients in and the trash out, then all of these other things that we're giving are for naught. So we're forgetting the patient in all of the quest to hurry up and fix this. At the bare bones, at the cellular level, if we would support the patient, then the body could do what it is actually inherently willing and ready.
You think insurance companies would look at it just from a business standpoint and say, look, let's take a real look at this. Is this a viable solution? And if they looked at the studies and the outcomes, they would say it is. And then they would look at cost. And as a business, they'd say, okay, ventilator this, we should do this first. You think from a business standpoint, it would be catching on. I don't know. There's just such a divide between, alternative and allopathic.
And that's where I wish we could change the word. It's not an alternative, because alternative.
Yeah, exactly.
It's with it. It is comprehensive, really. And
the divide is between big pharma and not, because you're right. Your father didn't look at it as this. He looked at it as medicine, right? He looked at it as, he didn't make the division. It must be a big pharma division that's making the division, is my point, because doctors that want to care for people, what do they care? They don't care.
No, well, and I think that, I've had some doctors reach out to me. It's not a lack of want. They want to do it. We've reached a little bit of resistance from the administration. So what's happening is the patient wants it, the patient's family wants it, the doctor wants it. They go to order it. Like I communicated with the pharmacist and they said, you know what, this just isn't in our computer system. We're going to have to talk to administration. So it's also shining a light on that the doctor really isn't allowed to doctor like they used to. So that's a big problem and that we are waking up to. It's not just inadequacies in politics. It's about our hands being tied, right? And that's really obvious.
Well, that's my point. And again, I'm not being conspiracy. If you just went upstream, there's a dollar value. Who's controlling it? Big pharma runs hospital, blah, 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 all the way down the chain. So I don't even want to get sucked in there. Let's talk.
There's hope on the horizon. Here's what I'll say. It is vitamin C's time. It's so obvious. Like when we first started, people know inherently when the chaos hit, right? When everybody's like, oh my gosh, okay, we're going to go on lockdown. The store shelves went empty, right? People knew that they needed these nutrients, that they inherently went to vitamin C. It's like they remembered, right? They knew they needed the zinc. They knew they needed all these other therapies.
Yeah,
so
zinc's go off the shelves too. You can't even find it.
Magnesium, right? They've got a lot of stress. They're using it for anxiety, but it doesn't seem right. And you're right. There's a major strain on the healthcare system. And this is something so simple. And I think that's the problem, is that it's so easy. They think it can't possibly be. But the hope on the horizon is there are some doctors that are not alternative or considered alternative. I might put that in quotes. They're pulmonary critical care specialists.
Right.
And they have done some studies and they have proven that it helps with sepsis. And there's a study that's been sort of holding things up, the Ali study, ALI, that they put in the title. So it goes to show you that also doctors they're crunched for time and then maybe they're not really reading the study. And in the title, it says of the Ali study that they didn't reduce organ damage. But if you look and read further, it actually reduced deaths in the ICU by using high-dose C by 16%. Now, the number needed to treat is like 6 to 8 people to save a life. And we know that people who go into the hospital who have acute respiratory distress are chronically low in vitamin C and vitamin D. And that when they supported the system, that these patients got better. So some of these similar doctors are using 1.5 to 3 grams, that's 1,500 to 3,000 milligrams, intravenously every 6 hours. And today I just got note of a study by Fowler and a group in Virginia that's actually going to use 100 milligrams per kilogram every 8 hours, which brings it up to about 50 grams. And that is the dose that we would use in a clinic setting for someone who has chronic disease like cancer. Yeah. So I'm very excited by that. It's in phase 2. And, there are studies, there are not enough studies for a lot of these doctors who need paper to say, let me do it. But for me, it doesn't make sense when you have enough. There are plenty to go by that show a reduction in mortality. So if the end game is to get people off the vent and to prevent them from even needing the vent, right now, kind of figuring out, okay, we need to put them prone. That's going to help them to get better oxygenation, right? So I don't know if you've seen that they're having to intubate and then put them forward. That's helpful just from a positioning standpoint. Simple things that are, we're in such a tizzy that we're not thinking sensically. Mm-hmm. So I'm really praying and hoping that unfortunately, I have not made a lot of headway in New Orleans. I will say in our clinic, we are treating people on the outpatient basis and getting amazing results. So if we could just translate that to right when they walk in the door of the ER, letting these people take oral doses, and maybe we can talk about that from a preventive standpoint. I just got noticed, people are sending me stuff ferociously too. So it's great because the information it's a lot. But, there are some places that are being told, hey, you cannot say that vitamin C is used for prevention for COVID. So I'll just say vitamin C has been proven to be preventative for viruses. Yeah, and exactly. Take it from there. And so to remind everybody that it really is like a stress hormone on all these other animals that make their own vitamin C. They double and triple the dose made by their liver when they are stressed and when they're sick. So for us to take more is really acting like giving our bodies this stress hormone it needs instead of thinking of it like a vitamin.
That's a good way to look at it. People don't understand that animals produce their own, right? Yeah. We have to be smart enough to get it in our diets.
So, and I think this is why the doses that I'm saying in our orthomolecular group, we're suggesting bare minimum of 3,000 milligrams a day in divided doses.
Yeah, so, we're going to oral now, folks, not IV. Yeah. IV, just to be clear, 25,000, 50,000, even above at times chronic illness. In 25,000 IV would be a real good preventative number too, would you say?
Yeah, it would. I mean, even 7,000 or 5,000. So the doctors in New York, that's Dr. Merrick, Keith Berkowitz, these doctors are actually getting results with 3,000 milligrams every 6 hours. And there's doctors who are getting results with 1.5.
Okay, but when we go down to something like 3,000 milligrams, now we can talk oral dosing. So,
right, so that's why it's not correlating. What people need to know is there's a massive spike, and the blood levels are almost 10 times exponential doses when we give it intravenously.
Right.
So it's going directly into the cell. We don't have to worry about any upset of the GI system. We don't have to worry about any bowel trouble. I also want to dispel the myth about kidney stones. That's not true. That just continues to get repeated. And so they have studies to prove, even out of Harvard, that those with the highest vitamin C levels had the least amount of stones. Mm-hmm. So I want to make sure we your listeners know.
All right. So, but when we move to oral dosing, you had brought up a challenge. Okay. So just review the oral dosing that you think would be effective daily.
I would say daily at least 3,000 milligrams. And if you have other comorbidities or other inflammation, the needed dose would be dependent on how inflamed you are. So there are people who could swell all the way up to 10,000 milligrams in a day. Mm-hmm. So that's not unheard of when you do the comparative studies for animals that make their own vitamin C. It would be based off your bowel tolerance.
That's right. And that's what I was just going to say. So if I took 10,000, I'd be running for the can.
Right. Well, it's a great way. What I was teasing someone saying, we got labeled somehow on Google as a colonics clinic. And ITs were like, well, we're not really colonics, but we do from above. We do oral colonics.
Exactly.
So listen, half the world is hypothyroid. So it's a great way to help with that constipation. You can kill two birds with one stone.
It's true. So I guess a good place for people to start is 3,000 and keep going up until your stool gets loose, obviously not too loose that it's a bad thing.
Right.
You don't want you soiling your pants.
Right.
However, come to that point and maybe back off just a bit where your stools are relatively normal, right?
Exactly. And then when we have patients who say, okay, I think I got exposed, or I'm starting to get a sniffle, or I'm starting to get fever, those guys are going to incrementally dose, like I would say, less more often. So whether that's 250 or 500 milligrams or 1,000 milligrams every hour until your symptoms start to dissipate, until you get loose bowels. If you are inflamed, you will not get the loose bowels because you're going to be using those electrons that the vitamin C is donating throughout that. And so less more often is actually more powerful, right? You're always going to have a little bit available for your immune system to do what it needs to do.
Yeah. Yeah. We, after dental appointments, we do something called a vitamin C flush where if you have access to IV, by all means, do it that way, right? But the oral dosing, we go up to where they have diarrhea and just back off a little bit. And stunningly, some people literally can go, over 100 grams or 100,000 milligrams, and they're still not having diarrhea. To your point, they're chronically inflamed.
Yes. And I think that's obviously also the light that's being shined, is that we have a lot of other things that are going on that our immune system is distracted by. And obviously the majority of patients who are getting sick or I hear of these cases where you have young people who are getting into the hospital. I think that's also proving your point that they have a toxic burden that maybe just isn't being measured by the standard American testing. So there's something else going on that the immune system is not able to do its job.
Oh yeah, totally. Yeah, because it wouldn't affect you otherwise. They just said, one of the experts last night, now that they're doing antibody testing, 75% of the population they believe has antibodies has been exposed to the virus, and 50% of that has had no symptoms, right? So meaning that it's so mild for the average person. So then we ask the question, then these cases that people are, horrifically sick, there's things that are making them stand out. Talk a little bit about that, because vitamin C is actually way more important even for those people.
So vitamin C, the other big one I'll say is vitamin D. So in our town, we have a larger population of African Americans that are getting very sick than Caucasian. And so they're notoriously lower because the skin is darker. So the conversion of vitamin D in the skin is not happening. And, there's also probably nutritional deficits that we're not aware of, that they're not checking. Zinc levels, right? This all boils down it's so plain to me that it's a nutritional issue that I guess I'm realizing now that
Yeah,
I'm
so
around
when they're
other
talking about,
doctors.
yeah, they're talking about diabetes, obesity,
Oh,
right?
well, for sure.
Heart conditions. Okay. But again, you and I would look at those people and go, oh, well, I mean, there's toxic issues with every one of them. There's immune system issues.
Yes.
There's nutritional deficiencies. So,
Well, when you look, you did a zinc, that was perfect. I watched a video. If you look at what zinc deficiency presents at and listen to when you hear the early reports of people saying, oh, I lost my sense of smell and taste, that's like zinc deficiency screaming at us like, hey, look at here, we need to focus on nutrition. But I don't think it's not an arrogance on the doctor's part. It's not like they're trying to not look at it. It's just really a lack of knowing. And I do think that it's also like a lack of, they've never used IV vitamin C other than maybe 500 milligrams that they would put in what they call a banana bag. So it's deeper than that. And I think what is going to happen and what is happening, and if I can just be patient, which this has been a challenge and a half for me because I like everything fast, I think you know that about me, is that these doctors in New York, the proof is going to come out. And as those doctors continue to speak and get their message out, the cat is out of the bag, right? On so many levels, and people are aware, and they're seeing the results for themselves, right? These family members, like we did not have any success with this one lady who was in the ICU, and we tried to get her some IV vitamin C, could not get it, but she did have an NG tube, so they were able to give her all the oral dosing that we decided, and she's off the vent now. So that'll be a story to tell, but it's happening. It's happening, and people are.
Yeah, no, I agree. So look, we both mentioned vitamin D. Let's talk a little bit about that, because vitamin C, vitamin D were, what I had told people, hey, this is something simple everybody needs to do, can do, right?
Yes.
By the way, should be doing every winter anyway, so let's be clear.
Well, you're bringing up a great point, because that's right now, this isn't just this virus. We're going to be exposed to multiple things. So this is something totally within everybody's.
Absolutely. And by the way, the average person listening to this or watching this, actually the regular flu is a bigger deal to you. I mean, meaning you might get the coronavirus, not even know it, but if you get the regular flu, you're going to be knocked on your butt. So therefore, the conversation could go, what do I need to do to prevent that? Well, vitamin D levels, especially in the winter when these flus are, more rampant, and then vitamin C levels. So let's talk about D. Dosing, let's talk oral, and then we can talk injectable as well. Because I've watched people who have so much trouble getting their vitamin D levels up. Vitamin D3 injections, different than D2. We can talk about that too. But let's start with oral. What is your oral daily recommended units? And it comes in units, just to be, it's a little confusing. But
yes, so it comes in international units, and our dosing is much higher than most, because if you look at the lab range, it will go from 30 to 100, and that's considered normal. Now, if that's the range,
we're talking blood test. We're talking
blood test.
Yeah.
Yeah, if somebody goes to look at their blood. So I don't want a 30, but there are doctors that will say, okay, you're good, and the patient's at 35. They're at the bottom of the norm.
I like that, yeah.
We like our patients between 50 to 80, and if they have chronic disease and they're ill or they have something they're fighting, 80 to 100.
I say the same thing. Those are my numbers as well.
Yes, and so I would say that in most multivitamins, they have about 800 IUs, and anytime we go over 5,000 IUs. So here's where we like to load our patients, and in times of stress, when like right now, when we don't have time to say, go look at the sun, go convert through the skin, I load my patients with anywhere between 50,000 and 100,000. And I'll do that 3 days in a row if they come in acutely ill. Now, we're also supporting with vitamin K2. That's the other fat-soluble vitamin. Anytime they're over 5,000 IUs, I need them to be sure they're taking the K, because that's going to protect the calcium from leaving the bone and then going into the vessels and other places we don't want it.
Yeah, so, by the way, I'm so glad you said that. I always warn people of that. If you're taking these higher doses of D, you'll be causing more problems. And by the way, that was always the old criticism, from doctors for years. Well, studies show that vitamin D causes, more hip fractures, causes certain immune factors, because they were just looking at vitamin D, dosing it high without vitamin K, which you said can potentially leach the calcium from the bone, which is not good. So you're right. Match it with the K, which is very smart. I hope everyone heard that.
And I also it's the same sort of thing. It's like we treat these things like vitamins, like they're sort of an extra. vitamin D actually acts like a hormone. I use it like a natural
Pro-hormone. It is a pro-hormone.
It's so huge for the immune system. And again, back to those natural killer cells. There are studies to prove that the lower the D, the higher your risk of cancer, which is also quite, these numbers are much more alarming than what we're dealing with right now. But I think if we can start to give a little bit more respect to these nutritional deficiencies, and also help people know that, remember when cod liver oil, there were things that our great grandmas and grandmas were doing that now we don't do anymore. And so we're lacking those nutritional benefits. So I think we do, that's why we're in the supplement world. And that's the other thing. It's like the supplements that we are using maybe are not the ones that are at the regular stores like Walmart or whatever. I don't want to name a big name, but they've been vetted. These are gluten-free, they're safe. You can trace the lineage just like you can a drug, a prescription drug. They almost have lot numbers. You can find exactly where that came from. So they're very high end, and that's available to people now.
Yeah, that's awesome. All right. So let's say, because I know some people watching this will be like, oh, I take vitamin D, I take it the way you said, and yet I still went to my doctor. I was only 32 on my vitamin D. What's going on? And then my thing would be like, let's do the injectable. Right? Because it could be a liver issue, kidney issue, a toxic issue, why they're not converting. Hey, we need the vitamin D up. Injectable comes in. What are your dosing there? And explain the difference of the old way of doing K2, which we always were critical of, but now they have the actual, K2, D2 versus D3.
D2 and D3. So the D3 comes from animal sources and it's absorbed and you can raise the levels higher. I'm not knocking D2. There are vegans and vegetarians who would prefer that. I have had a problem with some pharmacies when we prescribe it, they automatically switch it on the patient without them knowing, which I don't like that happening, but that's in their formulary. So they're almost like forced to do it, but I don't think that's right. But we use D3 and we use intramuscular. We can use anywhere between 50,000 to 150,000 IUs. We can do that weekly. We can sometimes do it multiple times in a week, depending on how low they are. And especially with these very sick patients, when they did studies, and this is multiple studies to prove that people with acute respiratory distress syndrome that are in the ICU, 100% of them were deficient in D. 100%. And if they do the same with C, they find that they're all low. So in these acute times of stress, we need more. And, I've never seen an overdose of vitamin D, never. And even at some of the conferences, I've been to speaking with some Canadian doctors who say, look, my patients' numbers were in the 200. They're watching the calciums. Now, nobody's doing this on their own. I just want to make sure we're clear. We're always under a doctor's care, but it's not, a little high level of D is not going to be something to be concerning. It's the elevations and the continued elevations and the calcium being pulled from the bone. So if you're watching the calcium in under your doctor's care, don't panic if you're at 100 or 101, right? You can bring it down, but it's the chronic levels of elevated D, and I don't ever see it. So the other point I wanted to bring up, because you did, is that they might not be absorbing. So what would be causing that? Well, a lack of C. You need magnesium. So especially in this time where everybody's so anxious, not sleeping well, that's another one we're making sure our patients take, and we're adding to the bag when they come. So they get magnesium. It is so powerful these minerals are required for all of these functions to happen properly. So it is really like a symphony. We can't just say, okay, you play the tuba and I'll play the horn and that's all you need. It's all of these things together. It's balance.
Yeah, that's amazing. And that relationship of C and vitamin D, I'm sure not a lot of people make, right? So, and then the vitamin K obviously is, a huge aspect. Many people watching this, their doctors giving them vitamin D perhaps without vitamin K. Even in the injectables, you still have to raise that K, because a lot of oral supplements now, the better ones, if you look at your bottle, you'll see D, you'll see K, you'll see A, you'll see E, you'll typically see a nice balance of all the fat solubles. And like I said, when you do injectable, you have to consider that as well.
Yes, and there are people who ask me, okay, what about K2? I can't take that. I'm on a blood thinner. They sell products that have just K1 in them. So there are different Ks, just like people know that there's B1, B6, B12. There are different Ks, there are different Es. So yeah, and there's different Ds, right? We have all these different numbers of these variants of these vitamins.
Yeah, this is great information. And then of course zinc. We both kind of just threw that out there too. I guess my top three vitamin would be C, D, and zinc. I mean, for these viral preventions, right? And we just mentioned other ones as well. But just talk a little bit about zinc. And I hate even bringing it up because right now someone texted me earlier saying, you know, I watched your zinc video but the problem is I can't get zinc. I need to get in multivitamins, but they're trying to find liquid zinc so they can taste. No one can find it.
I had the same. I had a patient call and say she couldn't find it. I said, you know what? Go look in your cabinet. I bet you have the zinc oxide for your nose. Just rub yourself down with the sunscreen. We might have to resort to that.
Yeah. Okay. I got good advice, but talk a little bit about people probably don't get the zinc connection with the immune system.
Well, the zinc. It's got antiviral properties too, and I think by ensuring they have enough zinc, we can also ensure these people who are getting chloroquine, hydroxychloroquine, and now some of the natural doctors are saying drink quinine from the tonic water. It allows the zinc to enter the cell. So again, it's about communication. Everything's on a cellular level, and so by letting the zinc get in the cell, then you have the antiviral properties, and it stops the virus from replicating.
Yeah. So you're saying the hydroxychloroquine actually allows zinc to go into the cell.
Yeah, it's like it opens the door. Mm-hmm.
Yeah, that's interesting. I didn't know that. There's actually a study showing that.
Yeah, it's an ionophore. Yeah, that's exactly right. It's allowing the charge to go in. Yep, and so the zinc, there's a lot of doctors who push ionic zinc, ionic mag. It matters because it matters whether or not the cell is what you're taking.
Yeah, and so I was saying on that video I was talking about just a simple test that you can do is the taste test for zinc.
It was great. It was old school. I loved it.
No, it is old school, but it works, right? I mean, I did it and it was like, ugh. And then, then someone else that did it, they were like, I don't taste anything. Okay,
you need it. Yeah,
you're iodine deficiency. Yeah.
Well, there are people who do that with iodine, right?
Iodine, same, on the skin. Yeah,
exactly. That'd be one other that I'm sure if your listeners haven't seen Dr. David Brownstein, he's really doing great work too. He's doing the same thing, seeing people in the clinic setting and doing excellent job giving them vitamin C, all these same things.
You know what's funny is I talk about the 5 big deficiencies, right? Actually, we're talking about them here, right? We mentioned D, we mentioned K, we mentioned, it's like, these iodine is in there,
we need them.
Yeah.
The soil is deficient. I mean, even if we eat the best, most healthy food, we're not getting it. I mean, whether
it's not in the soils. I mean, iodine, for example, I mean, it's out. And then we used to put it in salt. Now we're doing sea salt, most of us. We're not getting it.
Well, we're starting to become more aware of how can we supplement this. And now we're using like ion biome, we're getting fulvic acid, we're getting humic acid. But, with the runoff from the mountains, we're blocking it. We've got so many dams. I mean, it is no wonder we're starting to see the repercussions of the things that we've done. It's not that it's good or bad. It's just this is reality. So,
just, God gave us brains as humans and we just have to figure these things out. Certain things that are unavoidable, in our time, in our environment, et cetera. And we just have to respond to that. The problem is people aren't getting the message. It's like thyroid epidemic. I mean, my gosh, iodine is obviously a massive issue. I mean, you mentioned, we talked about vitamin D. It's a pro-hormone. I mean, hormone problems out the yin yang, and it's like, and yet vitamin D is a pro-hormone. It just plays into every bit of your hormone production. My gosh, this is so simple.
It's huge for cardiovascular health. I've had people who just come in for fatigue. That's all we did is I replaced the vitamin D. We replenished, obviously K. That's all we did. And they're like, I feel amazing, but this is, it is shining the light, I hope, for people to start to take a more proactive approach about their health. And, we've talked about this so many times that nobody cares about you as much as you. And so instead of being afraid or don't be scared, be prepared is what we're saying. Get your labs, find out about yourself, do what you can do to help support your immune system, because in the majority of the press releases, and you see these people on the news, the early instruction was basically stay away from everybody, get 6 feet away, and go home to do what? I feel like that's not helping people. There's so much we can do, and it doesn't just have to do with supplementation. It has to do with getting better sleep and removing any toxins that we can. Easy gimmies like turning off the Wi-Fi that you talk about. Not drinking out of plastic, and simple things that we can do to just continue to not barrage the immune system and help it in any way we can. Going outside. So being in better touch with nature, which this pause of the entire universe has provided.
Yeah.
Right? Hopefully people are going to go out in the sun. I'm not saying we need to go out to burn ourselves, but the sun is very healing, and we've gotten really far away from putting our feet on the earth and going back to nature. So
I see what I did. I took this downtime. I've got myself and my family in the sun.
Did you bury yourself in the sand? They say that's the best way to recharge.
It's the best way. You get some grounding and you get everything that the sun has to offer, and it's beyond vitamin D. But I said in the beginning, you're doing wonderful work there in New Orleans. I mean, you're always in the hot seat there. I mean, it's just somehow.
This place is special. We got a lot of good things.
This is a whole other show, and I'm willing to do a whole other show with you on it. But let's just touch on this, because one of the wonderful things you're doing there in New Orleans, where there's so much addiction, is NAD. Talk about NAD's role in this, because I have a feeling that NAD could be another big player for treatment for COVID, and it is for addiction. That's why I brought it up. NAD is a big player. So explain what NAD is. I just talked over a lot of people's head, and why I think it's so special.
Okay, NAD, it stands for nicotinamide adenine dinucleotide. This is a derivative of niacin, or vitamin B3. And so this derivative is really crucial in the Krebs cycle, or the cycle that helps us to create energy, or ATP molecules. One energy molecule is an ATP. We are using this from an addiction standpoint. We use it at very high doses intravenously multiple days in a row. And what it does is it allows, again, communication between your cells to help your neurotransmitters work better, so that you can have more reception of your dopamine. The dopamine is the thing that makes you want to get up and do things and feel good. And so we're able to allow these patients, it's almost like it opens a door or a window for them to not have the cravings that they're used to having. Like, I think it should be used as sort of a right on admit of all of these detox centers. I think they should give them NAD, because it allows their mind to be open and they're not craving. So the physical cravings are gone, and they feel well enough to now participate in whatever program that is. Now, the large majority of these programs are AA based or 12-step based, but it allows them to think very clearly. It helps the brain function, and it helps give them energy and gives them drive. Well, I'm sure we're going to see a large portion of the population who was sick enough with this virus, but not sick enough to be admitted. And I think we're going to have a lot of what we call post-viral fatigue. So we'll probably be using NAD in that sense too, to give these people that little extra energy to get them over the hump, so that until they really recover. Because like we talked about in the early part of the show, people with Epstein-Barr or mononucleosis, they suffer from a really long time of what they call post-viral asthenia. They're just exhausted.
Well, one of the things viruses do is they attack that whole energy system in the mitochondria. So, NAD wouldn't surprise me I would love to see a study on it, treating these COVID victims with NAD, because the immune system needs that energy and the virus affects it. It would be a very interesting study.
Yeah, there's also some doctors, we can talk later about glutathione. So they're using transdermal glutathione. That is not absorbed very well in the GI tract. So oftentimes we use it intravenously, obviously, but there's a liposomal that people use, but this transdermal, they're getting good results. And he's actually got some studies coming out of the States and out of Turkey with this transdermal glut. So
I interviewed a friend of mine who had years ago developed a glutathione. The product's glutastat, where you sniff it and push it right in. And
nice.
Obviously has a great impact on the lungs. That's that weak spot.
You reminded me, we open up capsules and have people nebulize it too sometimes. It's great. It's a great delivery. I mean, obviously the lungs, you can have such a higher systemic load by the surface area of the lungs, huge,
Absolutely. Oh, well, Dr. Mary, thank you.
I love talking to you. Thank you so much. I appreciate you very much.
No, this is great information. As a matter of fact, give people your information where they could contact you anywhere people fly in for your clinic for addiction and other things, many different things. So give them your information.
Thank you. So it's theremedyroom.com, THE Remedy Room. And then they can email me at info@theremedyroom.com.
And Ashley will put that in the show notes. So you have it. Wealth of knowledge.
There's hope. There's things you can do, people. You're not alone.
Absolutely. So thank you, Dr.
Thanks,
Mary.
Dr. Pompa. Talk to you soon. Have a great day.
Bye.
Well, that's it for this week. We hope you enjoyed today's episode. This episode was brought to you by CytoDetox. Please check it out at buycytonow.com. We'll be back next week and every Friday at 10 a.m. Eastern.
We truly appreciate your support. You can always find us at cellularhealing.tv, and please remember to spread the love by liking, subscribing, giving an iTunes review, and sharing the show with anyone you think may benefit from the information heard here. And as always, thanks for listening.